heart rate was 122 over 71. Thank you so much. Any creaking or cracking when you open and close your jaw?
No.
Okay, can you open your mouth? Okay, and then can you squeeze tight? Perfect. Okay, everything seems to be working order there. Cranial nerve number 5. Okay, now we're going to be doing cranial nerve number 7. I'm going to ask you to do a few silly facial expressions for me. Can you puff your cheeks? Can you smile? Can you frown? Perfect. So as he's doing these cranial nerves number 7, going through those facial expressions, I'm making sure that everything is symmetrical. I'm making sure there's no drooping, that he can do the facial expressions on both sides, and both sides are in working order and symmetrical and things like that. Now I'm going to be going through cranial nerve number 8, and I'm going to be testing your hearing, okay? I'm going to be doing a whisper test. So I'm going to whisper something in one ear, and you let me know what you hear, okay?
Boots.
Yes. The other ear.
Peanuts.
Perfect. Awesome. Cranial nerve number 8 is in working order. And now we're going to go through cranial nerve number 9, 10, and 12, okay? So I'm gonna be checking the inside of your mouth, okay? So the first thing I'm going to do is I'm going to have you say, ah. Checking that vagus nerve. Ah.
Ah.
Perfect. Okay, your voice. I'm going to look inside of your mouth, okay? I'm going to be checking also what can you put your tongue up? Okay, I'm checking for that tongue tie, making sure everything's symmetrical. I'm going to be also checking, as I'm checking for the cranial nerve, I'm going to look inside his mouth, making sure there's no lesions, any broken teeth, overall appearance of the mouth, making sure everything is pink, no like redness, any sores that could possibly come from like strep throat or anything like that. And then can you stick your tongue out, making sure everything is in working order. I'm checking for that uvula as well. Can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. And I'm checking that the tongue is in order as well. Perfect. So yeah, and then next I'm gonna be checking for cranial nerve number 11. Okay, I'm making sure that your neck and your shoulders are in working order as well. Okay, can you move your neck and head to side? That moving? Okay, perfect. And then can you shrug against my shoulders? Perfect. Awesome. So all 12 cranial nerves seem to be working in great order. Now what I'm going to be doing, I'm going to be going towards the neck. Okay, I'm going to be palpating both carotid arteries with 2 fingers, one at a time, okay? And while I'm doing this, I'm going to take note of the pulse number, which is a +2, which is regular. We don't want a +4, we don't want bounding, anything like that. Making sure it sounds normal. Making sure there's no prominent veins, any redness, any sores on his neck, any pallor, any cyanosis, anything like that. Perfect. Now I'm going to be looking at the jugular vein distension, making sure it's not protruding out abnormally on both sides. Perfect. I'm going to palpate as well. Okay, and we're looking at those lymph nodes. Okay, now I'm going to be looking at his thyroid. I'm making sure that it's center of his neck. I'm going to make sure that it's not protruding at all, making sure it's not enlarged, and that's in a butterfly shape. And then, do you have any history with any thyroid issues, anything like that? Like,
Nope.
No, does it ever feel like it's protruding at all or inflamed? No? Okay, perfect. Now I'm going to be going through the respiratory system, okay? I'm also going to check before I go, I'm going to be checking in the clavicle area for skin tenting. That's going to be checking his hydration. So I'm going to bring it up, making sure it goes back immediately. Perfect. Awesome. Okay, so for this area, I'm going to need my stethoscope. That's the code. Okay. Okay, so the first thing I'm going to be doing, I'm going to be using the bell area, and I'm going to be looking, just checking the two clavicle areas. Can you breathe in and out for me, please? Again for me, please. Okay, I'm going to be switching to the diaphragm. Go ahead. Okay, go ahead. Okay, everything sounds normal. I was looking for any crackling, any stridor, anything like that. I'm gonna be going to the back, but as I was going ahead and auscultating these areas, I was looking also at the symmetry of his chest. We're gonna pretend that he's shirtless. I was looking that everything was symmetrical, that as he was going in and out, it was symmetrical on both sides. If there's any redness or if he had any barrel chest anywhere, I was checking for that, which shows any respiratory issues. Yeah, that's what I was doing. Perfect. And now I'm gonna be going on his back. So could you, yes, perfect. I'm gonna be auscultating the back. Okay. So go ahead and breathe deep for me, in and out. Go ahead. One more time. Awesome. So now that we're done with the respiratory component, now I'm gonna be going through your abdominal component, okay? And for this, we're gonna have him lay down, and he's gonna put his knees bent up a little bit. Okay, so pertaining to your respiratory, do you have any issues respiratory? Have you had a history of asthma? No, you haven't. Is anyone in your family have a history of asthma or any wheezing? Have you experienced?
My dad.
Your dad has asthma?
Mhm.
Okay, from what age?
Older, well, 30s.
In his 30s, he got asthma?
He's asthmatic. Mhm.
Asthmatic, okay. All right, thank you for letting me know. Make sure to put that in my notes as well. And then, when was your last bowel movement?
This morning.
This morning? Are you sure?
Mhm.
Okay. And then, do you have any issues with going to the bathroom? Do you feel like you have a pretty regular schedule?
Pretty regular.
Okay. And then, is there like a certain smell? Like, does it smell particularly like
Smells
foul or okay? It smells normal.
Mhm.
Okay, cool. And then, what is the color?
Brown.
Brown. Okay, perfect. Does it change with the foods that you eat?
No.
No. Okay, perfect. And have you had any abdominal pain now or in the past? Like any appendicitis? Like any problems like in your upper half or anything like that?
No.
No pain whatsoever?
Mm.
Okay, perfect. Okay, so the first thing I'm gonna be inspecting, and I'm having his knees this way because it is a comfortable stance. Could you put your hands at the side, please? Okay, so I'm gonna pretend that his shirt is off, okay, and that he has drapes and everything on him. So first thing I'm gonna do, I'm gonna be inspecting, okay? I'm gonna be inspecting for any abnormalities. Abnormalities, would you be any ecchymosis, any redness, any eczema, any discoloration, and make sure that there's no lumps, no hernias present. I'm going to be looking at it from 2 different angles, okay? I'm just noticing that it is flat stomach, it is not distended or rounded or anything. We'll be looking at it from 2 different angles, making sure it is looking good, all right? Perfect, and making sure, noting the symmetry, things like that. Okay, so the next thing I'm going to be doing with the stomach is that I'm going to be auscultating. I'm going to check each quadrant and starting at the lower right quadrant for 5 to 10 seconds. If I don't hear anything in those 5 to 10 seconds, I'm going to go through each quadrant for 5 minutes for a total of 20 minutes. I'm looking for that gurgling. Perfect. Perfect, so I'm noting that as normal active bowel movements. So the next thing I'm going to be doing is that I'm going to be percussing. So I'm going to start in the lower right quadrant, and I'm going to be looking for tympanic sounds, except for in the upper right quadrant, it's going to be a dull sound because because of the liver present. Actually, it's going to be the upper left quadrant. That is where our liver is present. Okay, that's going to be a dull sound. Everything else tympanic. I'm going to be also palpating the kidneys. Is there any tenderness at all? Percussing. Checking those kidneys. Okay, now I'm going to be going and palpating softly, starting in the lower right quadrant. Is there any tenderness at all? Okay, now I'm going to go with the deep palpation. Okay, perfect. Now I'm going to be checking the McBurney's point for appendicitis. So what I'm going to be doing, I'm going to be pushing deeply in and rebounding. If my patient feels pain a few moments after their body has been released, it's showing positive signs for appendicitis. Are you ready for this?
Mm-hmm.
Okay. In the lower right quadrant. Did you feel any pain?
No.
No. Okay, perfect. That's negative for appendicitis. Now I'm going to be checking the Murphy's point. I'm going to be checking for any inflammation of the gallbladder. That's going to be in the upper right quadrant, and I'm going to be checking for any bulging, any tenderness, showing positive for inflammation in the gallbladder. Is there any pain there? Any tenderness?
No.
Okay, perfect. Showing negative for inflammation in the gallbladder. Perfect. Now we are going to be testing the upper extremities of my patient. Okay, you can sit back in the chair, Luca. So, I'm going to be going over your upper extremities, okay? So could you lay your arms straight like this for me? Perfect. So first thing I'm going to be doing, I'm going to be inspecting his arms. I'm going to be inspecting that it's symmetrical. I'm making sure that there's no significant or alarming muscle atrophy. I'm going to be checking if any veins are bulging out, any ecchymosis, any pallor, any eczema, anything like that. Is there unusual redness? Any lumps, any bruises? No, everything looks good. I'm looking at the hair distribution on his arms as well, and everything is looking normal. Next thing I'm gonna do is I'm gonna be looking at his fingers. I'm gonna be going over his fingers and checking for any cyanosis, any abnormal thickness. You know, sometimes people who weight lift, they get some not nodules, but calluses, but that is normal. I'm gonna be checking the capillary refill, and it goes back to its red color after being pressed in less than 3 seconds. I'm gonna be checking any edemas, any swelling, any pitting in the wrists or the fingers. No edema, no pitting. With that being said, I'm going to be going through the cardiovascular system as well after I do this. So I'm going to also be checking your range of motion in your shoulders and your wrists, okay? So could you show me an inversion of your wrist and go all the way out? Perfect. The other wrist as well? Perfect. Okay. And then can you push up against my arm? Perfect. Okay. And then go back and then push against. Perfect. Muscle strength is all there. +4. Okay. Can you go against me? Perfect. Again. Perfect. Okay, and then can you touch, I'm going to check the neurological components. Can you touch like this? Perfect, amazing. Okay, and then can you go like this? And then turn it around like that? Perfect. And then can you show rotation in your wrist? Perfect. And the other one? Perfect. The reason I'm having him do this, I am checking for range of motion in his shoulders. I'm checking, in his elbows on both sides, making sure there's no crepitus, making sure there's no tenderness. Have you ever broken a bone? Have you broken any of your elbows or wrists or shoulders, anything like that? No? Okay. Do you feel creaking in any of these joints or any tenderness or pain when you do these motions?
No.
No? Okay. Awesome. So next thing I'm going to have you do, I'm going to have you bring your arm up and go against my force. Perfect. Again. Perfect. And then can you go up? And then can you go side to side like this? Perfect. We're also going to do the same. Can you bring it up, please? Perfect. And down. Perfect. Can you up and down? And then like this. Perfect. Making sure I get full range of motion from the shoulders as well. Perfect. Now what I'm going to be doing is I'm going to be testing the reflex on the brachial tendon, okay? I'm going to be holding the tendon, I'm going to be pressing down this tendon, and I'm going to hit it, and then his arm should have reflex involuntarily jump up. Okay, perfect. Okay, amazing. Okay, so next I'm going to be going through the cardiovascular system. Oh, before I do that, I'm going to see if you feel, close your eyes, let me know if you feel it soft or sharp sensation, okay?
Soft. Sharp. Sharp. Soft. Soft. Sharp.
sensation. Okay, so now we're going to, I'm going to be going over, I'm going to be inspecting his chest and everything, and I'm going to be palpating the major arteries, and I'm going to be testing it for its blood flow strength. Okay, so a +2 is what we're looking for. A 0 would be very weak, or a +1 would be, you know, weak, abnormal, and a +4 would be bounding, which would not be a good sign either. So the first thing I'm going to do, I'm going to be checking, I already checked his radial pulse, and it was a +2. I'm going to be checking his brachial pulse. +2 as well. Okay, I'm going to be checking for the carotid artery. That's a +2. Perfect. I'm going to look at his apical pulse. +2. Perfect. Okay. +2. +2. We're going to skip the femoral artery. And I'm going to be checking his popliteal artery. +2. +2. Achilles artery behind the ankle, posterior. +2. And the other one. +2. And the dorsal pedis, which is on top of his foot. +2. And other foot. Perfect. +2. Now I'm going to listen to all 5 intercostal spaces of his cardiovascular system. So the first one I'm going to be checking is the aortic area. Can you release your chest? Thank you. I'm looking for some sounds. Next, I'm going to be checking the carotid artery and the space underneath his sphincter for any bruits, which is a swooshing sound that would detect backflow of blood. Next, I'm going to be checking the pulmonary valve. Next, Erb's point. Next, tricuspid. Mitral. Lifting this up. And then apical. Perfect. And then with the bell, I'm going to be checking our carotid artery for any bruits. Okay, and below the sphincter, checking for any bruits. Perfect. Now, what we're going to be doing, we're going to go through the lower extremities. So as I'm looking at the lower extremities, I'm looking for any pallor, any jaundice, any discoloration, any ecchymosis, bruising, things like that. I'm making sure that the hair is distributed evenly and normally. So have you ever broken a bone? Do you have any issues with your knees or your ankles? Do they bring you any pain at all?
No.
No, they don't? Okay. I'm making sure that everything is symmetrical, that the muscles are looking good, things like that. No sudden atrophy, anything like that. Okay, so what I'm gonna be doing is that I'm gonna be checking for also any lumps, any knots. None. Okay, I'm gonna be checking for edema. Any pitting? None. Okay, on the other leg. Okay, perfect. So I'm gonna be checking muscle strength. So could you push against my leg? Perfect. And then can you put it up again? And then can you bring it down? Okay, great. And then can you push up? Perfect. And then can you bring it down? Perfect. Okay. And then can you kick up against me? Perfect. And can you bring it down? Perfect. Can you kick up against me? Perfect. And kick down? Perfect. Okay, +4 on all of those. Okay. And then can you kick all the way up? I'm gonna be looking at the range of motion for his elbow. For his knee. Okay, perfect. The other one. Thank you so much. And then could you stand up for me, please? Next I'm gonna be testing his hips. Could you turn and face this way? Could you go around, making sure he has that full range of motion? Perfect. And you can go backwards, please. Perfect. And can you do the other leg? Perfect. That ball and socket rotation, make sure he has all of that. Perfect. And then can you go and reach backwards? I want to check the extension of your spine. Perfect. And reach down as well. As he's doing these things, I'm checking for symmetry in his back, making sure he has no barrel chest, as I said before, from the respiratory. You can go back up, making sure that everything is aligned, the muscle looks good and even. Okay, perfect. Everything's looking good and even, and he has no kyphonosis, any like any curvatures of his spine or any bendingness or folding. Perfect. And then could you flex your foot? Can you show a plantar flexion? Perfect. Plantar, put your foot toes down. Okay, and dorsal flexion, can you point your toes up? Oh, sorry. You can hold on to me. Point your toes up. Perfect. Okay, and then can you point your toes inwards towards your body? Perfect. I'm looking at his abduction of his ankle and outwards. Perfect. I'm looking at the abduction. I was looking at the abduction before. Now point your toes towards your body for adduction. Perfect. And away from your body with the other foot. Perfect. And I'm gonna be checking your neurological. Where can you scratch your foot with your leg? Perfect. The other one? Perfect. Amazing. Okay, great. What else? You can go ahead. Okay, and then I'm gonna look at your gait. Okay, can you walk from that side of the room and then come back? Perfect. As I'm looking at his gait, I'm making sure everything's symmetrical. Can you walk to your tippy toes, please? Can you walk heel to toe?
I don't know what that means.
Like, can you walk on your heels?
Oh.
Perfect. Amazing. Thank you so much. And you can go back down. I'm going to be testing your sensation on your lower. You can close your eyes and tell me if it's sharp or soft.
Soft.
Okay, other one.
Soft. Sharp. Sharp.
Perfect. Okay. And now I'm going to be testing the reflex in your quadricep, your quad tendon. Perfect. Okay, and then I have a few questions to ask you before you go, okay? It's just about mental health questions. Do you have any thoughts about harming yourself or harming others?
No.
No? Do you feel safe at home?
Yes.
Yes? Okay, perfect. Perfect. As I'm leaving the room, I'm making sure that my client is safe. I'm making sure there's no cords. I'm going to readjust their bed at a comfortable level. My name is Olivia. There's your call light if you need any help at all, okay? And perfect. And I'm going to leave you with your privacy, and the doctor will be right in.
Thank you.
Okay, you're welcome. All right, and then I'm going to leave and make sure to close the door for privacy and make sure that they are safe.